Hey guys, Lauren Losing here from my week 124 update from vertical sleeve gastrectomy surgery, which I had on August 21st, 2013 at Massachusetts General Hospital with Dr. Denise G. It's been a while since I've come to you. There are a few things that I would like to talk about. I don't expect this video to be super long, and that's mainly because I'm having those days, one of those days where I hate everything. So I don't expect myself to be in a super chatty mood and getting into my feelings about a bunch of stuff just because I'm like over it already. Over it meaning over this day. And there's really no reason for me to feel that way except for I haven't even finished my first coffee and it's almost noon, which I've usually had at least 2 by now. Okay, let's see if that helps. So in this video I'm going to be discussing my first plastic surgery consult. I'm going to be glossing over my meeting with my nutritionist that I had yesterday and my metabolic testing that I had. And the first thing that I'm going to address though is the diet bet that I am running right now and that I am not a part of. So it's going to be a short explanation, I guess. I don't mean this to be an excuse. I basically just fucked up and never signed up and haven't been even trying to lose weight on my own. So I had it in my head that when I weighed in for this second diet bet that I wanted to be 140 pounds or less because that's what I weighed in for at the end of my last diet bet. And then so the day that I went to weigh in, the day that it started, I was, I believe, 144, and you have up to 2 weeks from when it starts to submit your official weigh-in. So basically I just kept putting it off, and the day that I went to submit my official weigh-in, I was a day too late. So I was too late to even join the diet bet, so I paid $30 or $35, however much it was, to join a diet bet that I am not a part of, and I was not able to get that money back because you're only able to get your money back within the first week. So someone, whoever ends up winning the diet bet, hopefully it's multiple people, but you will get some of my money that I will definitely not be earning. So I really don't want to I just gave you an excuse, but I will say that the real reason is that my mind just really wasn't in it. So I'm gonna be really truthful and say that I was really into that first diet bet and I did a really good job, and I just kind of lost momentum. I don't know if I'm going to be running another diet bet. I don't feel like I am the best diet bet leader. I'm not active on the app. I'm not like challenging people. I'm not posting every day and saying, this is what I'm doing, what are you doing, and all this stuff. So I don't know if I'm going to run any more diet bets. You can let me know in the comments, I guess, if you find them helpful even when I'm not active actually in the game or not. So anywho, moving on from that, I will, I guess, next talk about my nutritionist visit because that should be pretty short. So I had the MedGem testing done yesterday. This is an appointment that I should have made with my nutritionist a year ago. So at the weight center that I go to, they suggest that when you have maintained your weight within 5 pounds for about 3 to 6 months, I think they say, that you should go and have this MedGem testing done. So what it is it's a fasting test. You can't eat or drink anything within 4 hours of it. You can't exercise. You can't have any caffeine. You really can't take any medications. and you breathe into this machine for about 15 minutes, and it's supposed to test how many calories you burn at rest. So there are, you know, estimations that can be done through math for, you know, using your gender and age and stuff like that to estimate how many calories you burn a day at rest. But then there's also this test, because obviously not everybody is the same. So, however, this test is most accurate if you were able to literally have the machine next to your bed and wake up in the morning, reach over, and then breathe into the machine for 10 minutes and not have moved. So because I had to get up, get ready, drive to my appointment, get out of my car, walk up to my appointment, it's still not 100% accurate. So they give you their estimation and they give you their calculation. And if your estimation is, you know, if your calculated resting metabolic rate is higher than their estimation, they basically tell you to like go between the two or even just use their estimation. So it doesn't really make sense to me why they would necessarily even have everyone do it unless someone ended up having a lower resting metabolic rate than what they would have estimated, because then your calorie intake should be even lower. So anyway, my calculated resting metabolic rate was 1630. So basically that means if I were to lay in bed all day, they calculate that I would need to eat 1630 calories a day to maintain my weight. Now, like I said, because I had to get out of bed and I was moving around and all that stuff, that they expect that that's actually not completely accurate, and they had me estimated at, if I were to lay in bed all day and not do anything, that I would need to consume 1350 calories to maintain my weight. And then with a sedentary lifestyle, which basically means, I mean, that doesn't mean sitting on your ass all day. Sedentary lifestyle basically means getting up and going about your day, but not taking time out to purposely move your body, I guess. So that, to maintain my weight, that was estimated to be 1770 calories or something that I need to consume to be lightly active and maintain my weight. So basically what I got out of my appointment was that, one, I need to go back to tracking. She did go over with me slightly my labs that I had done recently, but really didn't give me any, she didn't give me really any guidance, but that wasn't her, like, because it wasn't her place to give me guidance. Basically, I have an appointment with my physician in a couple weeks, and he will be giving me guidance when it comes to my labs, because I did have some slightly abnormal labs, but nothing that was like majorly concerning. So after I have my appointment with my physician, I'll go over my labs and what I'm doing to change those abnormal labs. Anyway, so what I got from her was that I need to go back to tracking, or I should go back to tracking, and that she was, you know, she was able to see that I had gained some weight since my last recorded weight through their system. Of course, my last recorded weight through their system was 132 pounds, and we all know that I actually didn't maintain that. I did tell her, I said that was a fluke. I said my happy maintainable weight was really 135 to 138-ish. So basically she said, they also give you the calculation of calorie range that you should be hitting for weight loss, and they say that for a healthy weight loss of 1 to 2 pounds a week, that you should be eating 500 to 1,000 calories less than what is needed to maintain your weight. So that is 770 calories to 1,200, what was it, 1,270? Yeah, so 770 to 1,270. So I should basically, if I want to lose weight, I should basically be eating about 1,000 calories a day. And I know that a lot of people think that that's too low, but it's the math. I mean, it's the scientific math that they gave me. I could be eating 800 calories a day. So basically she told me that I should really be, that, you know, if I wanted to shoot for 1,000, that she would be okay with that. But she really said that I should be concentrating on the number 1,200. Which I don't know. Not, I guess that was the wrong way to say that. I think that it would probably be better for me to shoot for 1,200 at first and then go down to 1,000 than to shock my body to go from, I've probably been eating about 1,700 to 1,800 calories a day recently, and that is way too much. So I think, I don't know, we'll see. I need to be basically, so all in all, from her appointment, she said that, you know, when I'm eating healthy, what I'm eating sounds great. She suggested possibly switching from cashew milk to soy milk to get more protein in my coffee in the morning. I really don't think I'm going to do that because there's much more sugar, but anywho. I thought this was going to be a short video, and we're already at 12 minutes. Okay. So I'm going to get into my plastic surgery consult. I had a plastic surgery consult with Dr. Sean Doherty out of Emerson Hospital in Concord. It is a community hospital in Massachusetts, so it is not a major hospital. And it is not like a surgical, just a surgical suite or a surgical center. So I found him because the doctor that he works with was on the list of top Boston plastic surgeons for several years, and so I found him online. My mother went with me to the appointment basically because she asked. I was planning on going by myself, but I knew that I would come home and she would have several questions, and it would just be much easier if she came to the appointment and heard what he had to say, as opposed to me repeating it to her. So, yeah, so I got there, and first he spoke to me and got a little bit about my history, and one of the first, so I went to talk about brachioplasty, so arm lift, mastopexy with augmentation, so a breast lift with implants, and a lower body lift or extended tummy tuck. I wanted a professional opinion on whether I would do well with a lower body lift, if they thought that I just needed an extended tummy tuck. So basically the first thing that I found out from meeting with the surgeon is that he does not do lower body lifts. He said, I think that they are a great procedure, I just simply don't do them because I don't see it very often, and I don't do them very often, and I'm not going to do a surgery that I am not, you know, fully comfortable performing, which is great. That's what you want to hear. He also said that he does not love doing arm lifts. He does do them, but he only does them for people who really need them because it is a scar from elbow to armpit, and if you're a woman especially and wearing sleeveless, that sure, you're not going to see it when your arms are down, but you're moving around, you're going to see that big scar. And he said that he ends up having a lot of, I was just going to say clients, he ends up having a lot of patients who end up really upset with a very large visible scar. Now, to me, that's a no shit Sherlock kind of situation. Like, yeah, you're getting an arm lift, you're gonna have a big fucking scar, and if you can't deal with that scar, then don't get an arm lift. But I guess a lot of people don't think about that before. So I guess it was the beginning of the appointment was a little bit of a downer. He doesn't like to do arm lifts if they're not needed, but I knew that I needed it and I know what it is going into it. And then he doesn't do lower body lifts, but obviously I was going ahead with the consultation anyway. He did tell me right from the beginning that if a lower body lift is definitely what I am set on, that he would give me the name of a surgeon who did them. So he gave me a nice paper gown. I got naked aside from my underwear, and then he came back in. So he looked at my breasts first and said that I was an excellent candidate for a breast lift with augmentation. He does silicone implants. If someone really wants saline, he'll do saline, but he had me hold both, and it is very obvious that silicone is far and beyond much better than feeling, and the way it looks, and I don't know, even under the skin, silicone much better. So he said that I would do really well with a lift and implants. Then he looked at my stomach and said, you know, he was like feeling it and everything. He's like, yep, you definitely need a tummy tuck. And so he looked behind and he said that he thinks that I would do really well with an extended tummy tuck with lipo on my love handles, and he was like, because that would shape my back. And he was like, you know, he was like, not a lot of lipo because you don't have a lot there. And I was like, that's nice to hear because I feel like I have a lot. Honestly, I was nervous for this appointment. I can't even remember the last time I felt nervous. I don't feel nervous that often. I was nervous for this appointment. I had a fear that I knew going in was slightly irrational, but I had this fear going in that he was going to tell me that I was too fat for a surgery. That I had not lost enough weight, that I had too much fat left in my skin, even though I know that liposuction is a routine part of skin removal surgery. I just had this fear that he was going to say that I hadn't lost enough weight, which, like I said, I knew was slightly irrational, but anywho. So yeah, that made me feel good. Because he was like pinching like the sides of the front sides of my stomach too, and he was like, that's 2 layers of skin that I'm grabbing. You have fat in there, obviously, but it's mostly skin. So obviously if I stayed with him, he would do just an extended tummy tuck with liposuction. But he did say to me, he said, I see why you're looking into a lower body lift. I think you would do great with an extended tummy tuck, but if you want a lower body lift, I think that you would be a candidate for it. And then he looked at my arms and said, oh yeah, you definitely need an arm lift. Not the worst arms he's ever seen, but he said, you know, like I would do lipo here, because you do still have, you know, fat in that skin. But he's like, if I just did lipo, you would just be left with hanging skin. I was like, I know. So I talked to him about doing, let me see if I can pull out my skin a little. Yeah, you can see it right there. So that's not my sweater. That is my skin right here hanging over my bra. So I talked to him about doing an extended one, and he said that would absolutely be an option. So something that he said that also I wasn't super excited about, but what I really liked about this surgeon was that you could tell that he wasn't just looking for patients or clients. He wanted to do what would give you the best results, and he was very honest. So that's what I really liked about him. so he said that, so something that I wasn't super excited about hearing, but, and might not be the case for every surgeon, but he said that he would do the 3 surgeries separately, and he feels like I would get better results. So he would not do the arms and the boobs together, or if I really wanted them together, he would, but he thinks that I should have full range of motion in my arms when I get my chest done, that I shouldn't be dealing with this pain when I'm dealing with my arm pain. He definitely wouldn't do them all together because he feels like you should have full range of motion in your upper body when you have pain going on in your lower body, so I understand that. But what he was saying was he would basically do the boobs first and then do the arms, and then he feels like he would be able to get a better result with the arms and doing the extended if he already had the boobs, if I already had the boobs done. So I'll see. It's more expensive to have 3 surgeries separately because you have to pay for the OR, so the surgical room, separately, and you have to pay for the anesthesia separately. If you have 2 procedures in 1 surgery, that's only 1 charge. So, however, if a doctor tells me that I'm going to get better results from doing them separately, I would rather pay them money. But I don't know. I obviously have to talk to another surgeon also, and if I decide to go with this surgeon, then I need to talk to him again. So, another thing that he told me that I really love that he told me is that I have very loose skin. He was like, you have very loose skin. Especially for someone who has not had kids, and I mean, obviously, like, getting up to almost 270 pounds is similar to getting pregnant and gaining a lot of weight, because I did gain a lot of weight in my stomach. So I was, you know, even bigger than a pregnant person, I guess, in some cases. But he basically said that I can expect to have a revision. You know, when you're laying on the table, you can only pull your stomach so tight, and if you pull it too tight, you're going to end up with these really wide, big, gnarly looking scars, so they don't want that. But he equated it to driving a car off the lot and it immediately depreciating value. So he said, you know, we would obviously pull you as tight as we can, but you have such loose skin that I would expect you to, you know, after you healed from that first round, to find more loose skin that we would need to, again, pull tighter later. So, I really appreciate that he told me that. Obviously, nobody wants to go into a surgery thinking that you're going to need a revision, but I also don't want to go into a surgery thinking that I'm not going to need a revision and then need one. So I actually really appreciated the fact that he told me that. Like I said, nobody wants to hear it, but I really love that he told me. So after this, so basically, I mean, I'll go over the prices and stuff, but after this appointment, I really didn't have a definite feeling either way. I really, really liked him. I'm probably leaning towards not going with him, because I'm pretty sure that I want a lower body lift and not just an extended tummy tuck. Like, there is some sagging in my bum. There's a little bit of, like, sagging on, you know, an extended tummy tuck would handle the side, you know, my little saggy sides, I guess. But, like, when I sit down in my jeans, and, like, if I'm wearing low-rise jeans and, like, my back's hanging out, like, it looks like my ass is hanging out, and it's really, like, loose skin from my back. It looks fine if I'm just standing, but, like, it's definitely there. So I'm gonna go over the quotes. So these are quotes for if surgeries were all done separately. And I will be very interested to see the quotes that I get from the next surgeon that I go to, because the next surgeon I'm going to is one that Jen RMY for me had, sorry, my hands are freezing, had a consult with, and from what I remember, she had consults for things that I'm interested in, that I don't want anything extra, but maybe I'm wrong, but her quotes were lower than this. So for brachioplasty, so that's the extended with liposuction, $10,000. For the mastopexy, so the breast lift with implants, $10,500. And for the extended abdominoplasty with the liposuction, it is $13,500. That is a total of $34,000. That is more expensive than if I were to buy a new car. Don't get me wrong, I was fully expecting it to be a lot of money. I will say that I was expecting it to be $30,000, which you're like, oh, well, 34 is not that much more. I was thinking, yeah, especially with it not being a lower body lift, it being just, or excuse me, not a lower body lift. I keep saying that I want a lower body lift. I'm saying that wrong. I want a belt lipectomy, I guess. So I don't want my inner thighs done. I don't want an inner thigh lift. That is not something that I'm doing. So I just want a 360 cut around and like this belt lifted and then sewn back together. So I guess a 360 lower body lift includes your inner thighs. That's not what I don't want that. But basically, so especially since that that's just an extended abdominoplasty and not, I would expect this pricing to be more like, so I would expect closer to $35,000, I guess, if I was getting the lower body lift. I would expect like the lower body lift to be around 15, and then like the arms and the boobs together to be not even 10 each, I guess. I would expect like maybe closer to 18 together. I don't know. So maybe I'm just wrong, but I was a little, you know, I did have a little sticker shock. I didn't show them. I was just like, okay. But I feel like these prices are pretty high. But maybe that's just because they are, you know, for both these quotes, it's, you know, paying for anesthesia each time and paying for the surgical suite each time. This is not including if you want to stay over in the hospital, which if I had these all separately, I would not stay over in the hospital. And even if I had upper body done first and then lower body, I don't think I would stay over in the hospital. But anyway, so that is my overview. I was not expecting this to be a 30-minute video because, like I said, I'm not in a great mood today, but that's what happened. So I hope you all have a great new year and a safe new year wherever you are. And I probably won't be making an update video and another update video for another 2 weeks, which is when I have my second plastics consult and my appointment with my physician to go over my labs and stuff. So if you see me before that, it'll be a surprise. So until next time.